I would assume that most parents just want to know, is my kid going to be okay? Do you find that that's the case?
Absolutely. They're scared and they want to know that the end is going to result in okay, safe.
What does safe mean?
I think safe means that they're not trying to destroy their lives or their bodies. And that as parents, we just want our kids to be on track and be well mentally, emotionally, physically. Addiction is the number one killer. So when I say that to parents, that this isn't anything to take lightly, it is knocking out more of our young people than anything ever has. I think having that information means we need to tackle this with that severity and that tenacity.
When you and I were talking another time, you said parents may be aware of the anxiety and the depression that their kids are going through, but what they may not be aware of is the connection between anxiety and depression and addiction. Mm-hmm. Could you speak to that?
Well, I often hear parents in the early stages and even mid-stage of, I don't know if they have a problem with substances. They have the problem with anxiety. I know that. He's been anxious since he was 5. And often, we talk with someone struggling with addiction. Marijuana and alcohol, it isn't the problem, right? It was the cure. It was the solution.
And yet the solution became the problem.
Yes.
Have you ever seen young people who may have substance use disorder, but not anxiety or depression or both?
I really haven't. They seem to go hand in hand. Again, remember that it's the drinking or the drugs aren't the problem. They're usually the solution. And it's the solution because I have anxiety or my mood is dysregulated in some way, shape, or form. So I'd say no. And again, all these things, right? We're human beings. Being wholehearted means I have all these emotions. Having an anxiety disorder means my emotion of anxiety, which I need for survival, has gone a little haywire. That's it. And with good reason, right? We have more anxiety disorders than ever before because of what we've walked through with COVID, because we weren't able to function normally.
So you have anxiety and depression and you treat it with substances. Mm-hmm. And then that contributes to more anxiety and depression.
The solution becomes the problem. And we're seeing more and more psychosis around young people trying to treat their anxiety or depression with marijuana and opening up a whole new world of mental health issues because of how they're trying to treat things. We can't treat the anxiety or the depression if someone is constantly self-medicating or trying to figure it out on their own. And so first and foremost, that just has to be removed.
So how does that process begin?
First and foremost, somebody will need to detox and get the substances out of their system. And then they need to be treated through the long-term continuum of retraining, rewiring the brain, healing the head and the heart, right? All the different things that come with it. And it takes time, especially when a parent says, my child has been anxious since they were 3 or 5. And could you please get this cleared up in 30 days?
And when you hear a parent say, my child has been this way since she was 5, do you blame the parent right away?
Oh, absolutely not. In fact, the opposite, because so many parents do feel like they've done something wrong. And if I feel like I've done something wrong, chances are I'm going to be defensive and I'm not going to see the solution because I'm wrapped up in my own defense mechanisms. And I'm not going to actually be too trustworthy of somebody trying to guide me, because I'm on alert. And so one of the first things I do is let people know that you didn't do anything wrong. You're not to blame, but can we gather more data? Because things aren't going to change if we're stuck in these cycles of blaming or shaming.
Yeah, blame and shame have no place in the world of recovery. It doesn't work. Do you start the process by telling parents, okay, we need to detox your child and then we can deal with those other issues?
Well, I'd say with that, they're agreeable. Sometimes I sit with parents that have actually detoxed with their child and they know that this is real. They know, depending on if it's an opiate detox or an alcohol detox or a benzodiazepine detox, that's real. And that's terrifying for parents. And many parents have sat with their loved one that was dead. and brought back to life. So they don't really, a lot of times I don't get much pushback on the detox. What I get pushback on is how long is this going to take?
Why do you think parents want to put a time frame on it?
I think that it's no different than how we all are in society. We're pretty instant gratification species right now, right? And I think that's no different.
We wouldn't ask an oncologist to speed up the treatment. I need to be cured of cancer in 30 days. So why do people do it when it comes to addiction recovery?
Well, I think it's lack of understanding about what's actually happening. You know, as well as I do, that we're still stuck in thinking this is a moral issue. If you just wanted to stop, you would. People just lack understanding about what's actually happening in the brain, and then what's actually happening outside in our societies, in the groups, at college. There's a lot of factors that come into play that I don't think people consider when we look at the time frame of how to heal.
You mentioned a moment ago, this is not a moral issue.
It's a flaw in chemistry. We have enough to know that my brain is different than somebody else's. And my brain is different because of my wiring. For whatever reason, it is what it is. I want to be able to regulate my anxiety. And if I have too much caffeine, there's no way that will work. My brain does something different. Now, I also have something that goes off in my brain that wants more caffeine, maybe when I shouldn't have it.
Jill, what are the benefits to residential treatment?
There are many benefits. The broadest one is having the time for a time in, a time to just reflect, take inventory on how I've been living my life. And I'm using I statements as speaking from that perspective. A person going into treatment doesn't often see it that way. Right? They're like, oh, I'm in my freshman year of college and I'm supposed to be having the time of my life. And now I'm in trouble and I'm going to treatment and they're going to call it a timeout, right? And I'm in the corner in the dunce cap. And I love to just highlight again what a gift this is for you to just pause, take a time in, let's reevaluate. Because if I can get the client to slow down enough to recognize life isn't going as planned, let's take a time out. Let's get the substances out of your body. Let's work with a comprehensive team that can help on all different levels. The head, the heart, the body, all of it can be assessed, looked at, and let's just find a way to find optimal health and get back on track.
And part of optimal health when it comes to recovery, or I guess anything else, is about establishing a community, about having that connection to other people who are on the same journey as you are.
Yes. Optimal health, we know we are wired for connection. We need each other. We need you. I need you.
And I need you.
So that is one of the benefits. If treatment was just you coming to my office every day, all day, well, that would be lovely in many ways for a couple of days.
But then what would happen?
Right. So I love the concept of treatment centers having group therapy and working with others because it brings up new, interesting parts of myself, maybe that I can't discover on my own. So I love that. That's another added benefit of the treatment experience. Most treatment centers do have that. It just makes for a rich awareness and understanding of myself.
Self-understanding is interesting and it can be difficult. Sometimes we don't want to, especially when we're younger. We don't maybe understand what's going to happen when we go in there and take a look. What do you see?
Well, I love that you say that, Lori, because most often, I mean, as a woman in my 50s, I think it's one of the funnest things to do, to be fascinated at what's happening in my life. Now you get a 21-year-old young man. No, it's like the last thing he wants to be doing. And what we know is there's all the underneath stuff. And when you get the opportunity to have the time in, this time to reflect, I get to see miracles happen. Miracles meaning like they slow down. Often we hear the guys call it vulny, which means they get vulnerable. Vulny. And what that means is that we're just, and again, in that group setting, and you get to hear a young man share about being bullied. And all of a sudden, The other guy says, yeah, me too. And me too, and me too, in a whole different way of what me too means. And not at all. Very similar at the same time. So then they recognize, wow, we got really vulnerable together. I thought I was the only one, that was bullied in this certain way. And then that's when I started like not wanting to hang out anymore. And I started just smoking pot, or we start just connecting dots. We're not hanging on the surface anymore. We have a chance to go underneath and deal with the underlying causes and conditions.
What are the biggest misconceptions that parents, might have about residential treatment?
I think the main one is that it doesn't have to take that long. Yeah, you get them for 4 weeks and please cure. They lack really what it is. Or a misconception is just have them see the psychiatrist, put them on the right medication, and everything's going to be okay.
And we're done.
And we're done. Again, just part of that instant quick fix. I can take something from the outside to make the inside better. And that's not what it takes. The misconception is that we think the answer is going to be as linear and make sense as everything else I'm used to.
The progression of addiction is all over the place.
Yes.
And recovery isn't linear.
And it's very, very often so much different than what families think. It's difficult as a professional to go, okay, this is what we need to do now.
And I would think that parents, perhaps more of the dads, want things to go from A to B. Mm-hmm. I'm the dad. I'm a man. I'm a problem solver. I want to come in and fix this right now.
And so many fathers, they can run big, successful companies and they're so baffled at why can't I get this figured out?
Why can't I run my kid the way I run my business? I don't get it. Why is my kid messed up? Why is this happening in my family?
I get sad because these are families that would give everything if I could just fix them. And to me, it just shows I would do anything I could to fix it. And I can't, right? So we come back to the original question of misconception of the treatment experience. Time takes time. The main misconception is it can be done quickly and easily and tidily. And it's not. It's messy.
But nothing worth doing is done quickly. At least in my opinion.
I agree.
If you want something done right, if you want something done thoroughly, you got to let it breathe. And that's hard when we're worried that our child is going to die.
And a misconception that once they go to treatment, they're going to stop and we're done.
And in many ways, rehab is just the beginning of the journey.
Yes. I wish people would understand that more. And including myself. Sometimes I am a person that went to treatment once and was taught some ways. And I went, okay, thank you. I want this and I'm going to do whatever it takes. It's not necessarily the case across the board. And so this wiggly place is more the norm.
I got sober the first time I tried. I'm very lucky. But I know you and I are anomalies.
Yes.
Right? Most people don't just get it right off the bat and never use again. Overall, what should parents keep in mind when it comes to residential treatment?
I hope that they find a place they can trust. Because what I want to say is trust the team and talk to them and then get out of the way. Like collaborate in the beginning. We need information that you offer and then let your child have that time in. Let them spend some time unpacking some things maybe they hadn't looked at before and go to family program, however that looks, and learn a new way to be in relationship with your young person.
I have heard about many families myself who have thrown hundreds of thousands of dollars towards this disease, or some parents who are literally $1 million into this thing. At what point do you just say, we've spent enough, or do you counsel families, stop spending your money? This kind of treatment isn't working.
I don't know if there is a specific point, but there is almost a specific flavor. that I see in, there's a desperation in parents. And there's also a desperation in the kiddo that's been to so many treatments. It's kind of like the learned helplessness. I don't know how to function in life. I only know how to function in treatment or in this cycle, right? And it's that flavor when I'm like, we need to try something different. And you've thrown all the money and it's not working. They've had all these time ends and it's not working.
Sometimes they don't work.
So if we say it's not working, I do think that we can build on it. It's not for naught. I think every time somebody gets an experience of having a timeout and a time in, that they can continue to build on it. But that's when it's like, hey, I'm not going to fund this anymore either. Oh, but Jill, if they don't go to treatment, they're going to die.
But treatment isn't working.
It's not linear and it's called for a lot of different things. And you know the same as I, there's different places where people can get sober. And a lot of times it's just getting your butt to a 12-step meeting and sharing.
And they're free.
There's lots of options. I can't say there's a certain point, but it is the flavor. And am I making this decision out of love and wisdom? Or am I just throwing more money at it because I'm afraid and I'm actually just fed up? And I see that a lot. Parents will go, I'll pay for it again. I'm not doing family program because I've done that the past 5 times.
And I'm sending my kid back again because frankly, I don't want to deal with him anymore. I hear that a lot. I didn't know what to do with my daughter, so I just sent her back to treatment. And that's no good, is it?
No.
Yeah. Not every family can afford to send their child to treatment. And I'm sure that you've had experiences where families have had to take out a second mortgage or take out a loan from the bank. Is it worth it?
Well, I'm sitting here as someone that didn't have the finances to do that. And we've talked a lot about my son, but I also want to say that there was a point in my life where I looked for treatment for my husband. And that was at a point in my life where we certainly didn't have resources for it and did have to do those things. And yes, it was worth it. I think it saved his life. And for my son, was it worth it? Again, same situation. We had to do things differently so that we could support him and save him, right? And was it worth it? In my case, yes. But I think, again, we're in this different ball game. I think we have to ask the question, okay, we've done it once, we've done it twice. Here we are in third
time, 17th time.
Yeah.
26th time.
So It's not a blanket, is it worth it or not? Yes and no. It's both. And we have to look at the data and the patterns.
But really, doesn't it come down to the adolescent or the young person wanting to get better? You can't do it for someone else. So doesn't so much of this come down to willingness of your child to actually get help or not because they're still young and maybe they don't have the willingness?
Well, you hear it all the time.
Yeah.
You know, oh, I'm here because I got a DUI and the courts just want me to go to treatment. I'm not really here for me, so it doesn't count. And my husband's the one that taught me. He goes, I didn't want to stop. But I did want to stay married. And you gave me the option. I packed his bags and I said, I've got you a bed. You go to treatment or I'll go to the attorney tomorrow. You pick.
Wow.
And he said, I picked you. Our son, I don't get to divorce my son. He got different options. Your bags are packed. You have a bed. You choose that. You don't get to come home. I don't know where you'll live, but if you choose this path, we will offer everything we can to help you. If not, there's not much support.
And when people choose recovery, they give themselves the greatest gift in the world, in my opinion.
Themselves and all of us too, right?
Yeah.
Because it's quite a pain journey.
It's a journey that impacts so many people. On the negative part of the journey, when they're heading down, maybe they're taking people with them and they're crashing and burning and you just hate watching it. But then when it goes the other way and you start to see progress, they start building on what they have. It's glorious to watch and it's so fulfilling as a human being.
Right. I'm so passionate about this work, Lori, because hurt people hurt people. And if we can help people with their hurt, it changes the world. And I'm not just talking about the drug addicts. I'm talking about the mamas and the papas that are walking in fear and terror. I had a mom that would call, I'm terrorized, Jill. She was hilarious, but she was in terror constantly that her son was going to die. And I worked with her more than her son. And when she started regulating more and taking care of her fear and her terror, he stayed sober.
He stayed sober.
Hurt people. And if I don't clean up my hurt, I am going to share it.
And that's hard because a lot of times people don't even know that they're hurt.
Exactly. That's why we're doing this, right?
That's why we're building this platform and doing what we're doing. Regarding that precious time, that tender time when your child is released from rehab, gets out, and then you decide what the next step is. What messages do you have for parents to keep their expectations right-sized?
Yeah. They're so excited to think that now we're going to launch. And really, the main message is slow down still. Slow down. The main message is, what does the professional team recommend? I'm in this real time right now. Oh, we've got this beautiful place for him to live, and it's with family. He's going to be wrapped up in love. And I said, where's the sober community? Well, so-and-so sober. Where's the community? You can't just put it on the uncle. Well, he'll be so close. Let them wrap themselves up with the love and the support above and beyond the family. So if they've been in a rehab that is focused on community, let's keep that going for as long as they want. The jobs will come, the career will come, the degrees will come, but time takes time. And let's build a solid foundation. 30, 60, 90 days is not enough time to build a foundation.
Jill, what's the concept of a step-down program?
So let's say somebody has done 90 days of residential treatment. We would want to slowly step them down into a sober living environment that has a clinical component. So you don't go from doing group all day, every day, to having no clinical support. So we're going to step you down from that residential program. Now we're going to have you do an IOP, which stands for intensive outpatient, that you now have group 3 nights a week. So you get to have your life all day, but 3 nights a week, you're going to come back to this community of guys, and you have a clinician there that will help you process things. And then we slowly go step down from 3 nights a week to 1 night a week to eventually no nights. And you step into your life. And we highly suggest that you stay in therapy at least once a week where you're with a clinician. And the reason for that is just to help unpack, more importantly, how to navigate and continue to regulate if somebody has a co-occurring issue such as anxiety or depression, which chances are you do, that you have a clinician to meet with weekly that can help you practice your skills, help you hold that checks and balances so you, again, get to just step down in clinical care, step up in your life.
What is a sober living community?
It's a group of people that are choosing a sober lifestyle. And when I say sober lifestyle, I'm not just talking about alcohol. Sometimes people are confused about that, but it's all substances. A sober living environment is usually a place of monitoring. So they are getting regular testing, and that's the most basic type of sober living.
But it's where everyone's under one roof, right?
Yes.
Okay.
So it's a house with a room. Sometimes you share a room. Sometimes it's a single room. But that is the basis of sober living. And then we go from there where different sober livings offer different components and I think meet different needs, different types of qualities of sober livings, all of that. I would say the best sober livings have weekly community meetings and they learn how to work together in that house, right? That it's not that whole community theme that we've touched on is the reason we want people to attend and live in a sober living. They have built-in community. They Best quality sober livings have activities planned. They bring in alumni, which extend the community even more. Lots of them have 12-step meetings on property. So not only just homes and rooms, but there's a community basis. We can play pool and go to meetings and have fun together. They have requirements, sober livings, that say it's a gift and an honor to live here. And to live here, this is where we ask you to rise. You get a job. You hit a certain amount of meetings. If you don't need a job, and sometimes we have people that are at that place in life, then you're asked to volunteer. Quality sober livings help people step into their life more and more. And we want sober livings that help people find a life worth living.
Because life is worth living.
Yes.
Even if you don't see it at the time, it is. So the good sober livings have checks and balances.
Lots
right?
of checks and balances.
And they do urine screening, breathalyzers, that kind of thing.
All that, yes.
So would it be good to tell parents, hey, when you're looking for a sober living facility, find one that has the checks and balances. Find one that offers the urine screening and the breathalyzers.
Absolutely. And above and beyond that, one that has IOP option where they get to have clinical programming still and support when they leave residential treatment. The goal is that we slowly have you step into life more and more, but that you have this incredible safety net as you step into it. Because like we talked about, chances are they're going to fall down.
Seems to me that the whole point of sober living is to create a sober life and learn how to have fun. I didn't get sober to be miserable.
No way.
And that's what I tell people all the time. You actually can have fun in recovery. So what does that look like for a young person who might be living in a sober living facility?
Well, I'm sure it looks different in a lot of different places, but in Colorado, they get to go fly fishing, rock climbing, mountain biking. In the winter, they get to go skiing, and there's golfing. There's so many different things. And that's where I find people like active, using their bodies, their hearts, their heads, just having fun. And then also going to school, finding careers that help them, like you and I both talked about, giving back and helping others.
Learning to live a well-rounded life.
Well-rounded, balanced, connecting with family and the family of choice that they start creating. Not being focused just on getting a girlfriend or focused on making a lot of money, or if I just get this degree, or we don't want it to be, I'm just going to go to AA 24/7.
You know, I made that mistake of focusing like only on AA when I first got sober. And I realized, wait a minute, I still have a full-time job on a TV network. Like I need to stay focused and be more balanced, because all I wanted to do when I first got sober was be with people in 12-step meetings. That's it. But then I had a career. I had my friends and family. I had other things I had to balance.
Yes. And when we get the gift of sobriety, it's so we can show up for all of it. But we get to pick and choose.
And it's about thriving, not just surviving.
Yeah.
Right?
Oh, I hope so. Because we all have been doing enough survival the last few years. Collectively, so much grief and anxiety that it's really important when we're talking about this to recognize the impact it's had on our young people. And I think the correlation of we're seeing such a spike.
Is there a prescribed amount of time that a young person should live in a sober living home or not? Or does it just depend on the person?
I really feel like the 12 months is a magical number, partly because of the construct we tend to have in our own brains, right? But depending on the drugs that they use, depending on the different systems you have set up in other places of your life. But if we've got somebody that's building and creating a life, building that foundation beyond 1 month, beyond 3 months, and now we've got 12 months that I've been fortifying this new way of life, these new pathways in my brain, that sets a platform to step into life in such an incredible way.
Well, if you think about sports, would it be better to go to a tennis training camp for 3 months or a full year?
Ooh.
Or if you're learning a new subject in school or you're getting another degree, do you learn it in 3 months or is it better to learn it in a year?
And it's not like that's all they're doing for the full year. Again, we have people that you just slowly start lessening the amount of time that's spent on these necessary retraining of the brain, right? And the body, and stepping into life more and more.
And then stepping into life after sober living looks like what?
It looks like, again, slowing down enough that we're doing things on purpose. We're setting up a life. What I find often where I'm associated with a treatment center in Colorado, the guys want to move in right down the street, and they still come around and they share what they have with others. And it's beautiful. Not that everybody has to do that, but how do you set up your life so that you're going to continually take care? It's almost like a newborn baby. If you've got a 1-year-old, are you like, oh yeah, now you're good, go have fun?
Good luck.
No, it's still, how do I tend? How do I take care of this? How do I protect? And I often say to parents, if this is a gift, how do we protect it? So you don't spend $50,000, $60,000, $90,000 and go, okay, now we're done. No, you've got to actually continue, you as the parent, set up the boundaries so you get a return on investment. And I'm not talking about finances here. I'm talking about your kiddo back.
What I know to be true is you got to give it away to keep it. And so by going from a rehab to a sober living facility and then living on your own after that, but then giving back to the community that helped you so much will go a long way, I'd think.
It really does.
In long-term recovery.
It really does.
Is addiction ever just a phase?
Addiction is never just a phase. I want to be clear about that. Addiction is a very specific term that we're using. Can partying be a phase? Yes. Can substance abuse be a phase? But addiction is dependence. And when somebody finds themselves in that, whether you're 17 or 50, then you got to treat it with the tenacity that it deserves and demands.
And you're never cured from addiction.
I have not found that to be the case.
There's no cure for addiction, but you can go into remission.
And I think some parents may ask if it's a phase. Oh, they're in college or they're this or they're that. And there's where I'd say, we don't know, right? But what I'd find, if somebody ends up in treatment time and time again, chances are they have addiction and it's not a phase.
Recovery is a gift. Obviously, I didn't understand that until I got into long-term recovery. When I first got sober, people said, Laura, you may not see it now, but this is the greatest gift you're ever going to get. And it's the greatest gift you're going to give someone else.
And I often say to parents, I'm like, you are now in a club you never wanted to be a part of. And they start connecting and loving each other, supporting each other.
And it's true.